In this video, we're going to have a look at how you can record the birth preferences for patients, typically when they attend at their 34-week antenatal visit. Before you start, it will be important that you add the new maternity birth preferences note type to your favourite note types. To do this, choose the Documentation tab from the left-hand menu and then Add. From the toolbar at the very top of the screen, you then want the View menu, and from the subsequent drop-down menu, choose Customize. If you've already chosen some favourite notes, they'll be on the right-hand side. But if you haven't, this would be a good opportunity to move all of your favourite note types. This will save you time and make it easier to select the right note. So from the left-hand column, you can scroll down to the maternity note types. Highlight the ones we want to move. So especially here, we want the maternity birth preferences. We select the blue arrow. Just choose the second one down. The top arrow moves everything across. If you need to, take the opportunity to move the other maternity note types as well. And if there are other note types that you regularly use, you can save those as well. So, for example, you might want the obstetric progress note. Once you've made your selections, you click Apply and then OK. And Cerner Millennium will remember your favourites. Finally, in the drop down here, toggle to Personal. And you'll see from now on, you only see your personal favourite note types. So having done this, we can now return to the antenatal M page in the obstetric view, which I'm sure you're all familiar with. We have a test patient here who happens to be 34 weeks pregnant and has come for discussion of birth preferences. Now the preferences will be entered on a form, and you can access this form in a number of ways. You can click on Add a birth plan from the birth preferences component. You can use the drop-down menu in the same component or the plus button. Or finally, you can choose the ad hoc folder from the top toolbar. Select the maternity folder and you'll see the form in there as well. In this example, I'm going to select Add a birth plan. Now when I do that, the new maternity birth preferences form is going to open. You'll see that there are a number of mandatory fields indicated in yellow, and then there's some optional fields which are highlighted in white. Once you've had discussions with the mother-to-be, you can complete her preferences, so her preferred name, details of any birth partners, the preferred place of birth, details of whether any healthcare professionals should be present, and an important box here to indicate whether the birth plans are outside of the normal criteria. If you say no, there's nothing else to do. But if you say yes, you will need to fill in and indicate whether the MDT had been formed and any actions completed. If known, you can enter the date for induction of labour or caesarean section. There are spaces for the named midwife, the midwifery team, and the named obstetric consultant. This is a read-only box and it will display any antenatal risk factors that have been logged on the system. There is an aid memoir of things to discuss with space to indicate that these discussions have happened. As well as a free text box for you to write down any specifics that have come out of this discussion. There's also a mandatory field to indicate whether any of the birth plan comments will require action. The final few boxes should be fairly straightforward. Fields with square boxes will allow you to multi-select responses. There are also spaces to click Other, and whenever you click this, you'll be prompted to add some text to explain what's meant by that. There may be areas where the mother-to-be is not yet completely sure of her preferences, and to enable you to fill the form in, there are boxes for you to say undecided. There are also spaces to document where particular preferences have been made. The mother-to-be has also been made aware of the reasons why this may need to change. There's an optional box to indicate who will cut the cord, and further boxes to indicate the preferences for delivery of the placenta, the administration of vitamin K, and the current planned feeding methods. And then a final free text box for any other comments to highlight things that are important for the labour and birth. Having completed the form, simply click on the green tick in the top left-hand side to save it. You'll notice that some of your responses have pulled through into the birth preference component. This means they'll be very easy to view at any subsequent visits, either antenatally or during delivery. The form itself will be stored in Form Browser, so if you need to amend anything, you can simply find it there. Just with any other form, double-clicking to open it will open it in a read-only view, but a right-click will enable you to open it in a modify view. If for any reason you don't see your form, then check the date range here, because if the form was created before this date, you won't see it. Right-clicking in this grey area will allow you to change the date range to surface the form. If we decide to modify it, we can simply make the necessary changes. So in this case, it's now been decided we will have skin to skin. That preference can be changed. The form signed. Form Browser indicates it's been modified. And the preferences will be updated in the birth preference component. Finally, we need to go to clinical notes. We need to create a new note. Select that new note type, so maternal birth preferences from your favourite list. And you'll notice at once that it's pre-populated with some demographics and GP details and a summary of those birth preference discussions. You need to give the note a title and then sign it as usual. On signing the note, if the mother-to-be is using the eCARE patient portal, she will get a message indicating that she has a new letter from Milton Keynes Hospital. And when she clicks on the link and authenticates, she'll see it's a midwifery letter. And as she clicks through, she will see her copy of the birth preferences document. She can then save that as a PDF, print it off, or use it as she sees fit. If the mum-to-be is not using the eCARE patient portal, you can still print a copy of this document for her. So when viewing the document, select Print Medical Record Request and choose the document template. Select a reason, such as for patient purposes, and then preview the document. Once ready, click Yes. You can preview the document, which is rendered in a reasonably attractive style, and you can then print it on your local printer. The hope is that by using this workflow, not only will we have better documentation of the birth preferences of our mothers-to-be, but we'll be able to report on the percentage of women who have birth preferences in place. And we also have several ways of sharing this information with not just our patients, but also other providers, for example, in the community.